Good afternoon, one and all. I'm Medini H. Gowda, pursuing fourth year PharmD in Sri Adi Chunchandgiri College of Pharmacy. It's my privilege to introduce Dr. Sreekanth Konda, currently working as Principal Advisor at Ministry of Health, New Zealand. His previous role was Senior Clinical Quality Improvement Advisor, Healthcare New Zealand. Dr. Sreekanth Konda is a medical graduate from India with a post-graduation in public health from New Zealand. Due to his interest in public health and data analysis, he worked previously in various roles in New Zealand as Senior Health Intelligence Analyst for Wellington Hospital Capital and Coast DHB, and as a health advisor for Morai Health Organisation and GP practice in Hawke's Bay, New Zealand. Dr. Sreekanth Konda has worked as a senior clinical analyst for ACC Treatment Injury Center and was involved in assessing patient safety to support quality of healthcare by sharing information, sector engagement, and case study publications. Dr. Sreekanth's skills are in outcome measurement, health data analysis, presentation, case studies, project management, adverse events, and root cause analysis. His area of interest and expertise include evidence-based medicine, preventive medicine, primary care medicine, healthcare management, health promotion, public health education, health intelligence and analytics, patient education, healthcare quality, health outcomes, and patient safety. Though Dr. Sreekanth is from medical background, he has a keen interest in pharmacy related projects and is currently working on medication adherence with a goal to increase the medication adherence for home supported patients and measure outcomes. Dr. Sreekanth Kunda is also a member of Medication Safety Advisory Group, Health Quality and Safety Commission, New Zealand. Thank you. I would like Sir to take over the session.
Thanks, Medini. Good morning, all the students and all the participants in this webinar. I'm Dr. Sreekanth, as Medini has introduced me. I'm thankful to Dr. Karthik actually to invite me to do this presentation. Can you guys all hear me properly?
Yes, sir, we can hear you.
Thank you.
Yes,
so
sir.
I'll just share my screen. Just let me know if you can see my presentation. Cool. Can you all see my screen?
Yes, sir. Yes.
Thank you.
Yes, sir.
Thank you for being here today. So as Medini has introduced, just a brief introduction is, so I'm a medical doctor. I hail from Guntur in Andhra Pradesh, and I studied at my medicine at Anantapur Government Medical College. And in 2009, somehow I took the wrong flight and ended up in New Zealand instead of going to America, as usual, like all the Andhra doctors end up. So my colleagues and friends even make fun of me now, actually, like, why did you go to New Zealand? This is the reason why. So I'm just currently living in Wellington City, which is the capital city of New Zealand. New Zealand is also known by the local Maori name called Aotearoa. Aotearoa means land of longest white clouds. So you can see the beautiful scenery. Can you all see the pictures?
Yes.
Yes, sir, we can see.
Sir.
Cool, thank you. So this is the beautiful picture of my city, Wellington, from a flight I took. And then that is the second picture on the right is the picture from my backyard. So you can now see why I stayed in New Zealand, stayed back after my studies actually in New Zealand. So coming to the part, so what does health mean to you actually? So what do you think health is? So the definition of health offered by World Health Organization is a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. So this broad definition suggests that whilst health can be about specific symptoms, such as our ability to move around or to be free from pain, it extends to all areas of our lives and will include things such as socializing with friends and how we feel as a person, actually. So, what comes to mind when you think of health? Is it being free from all illness, or being free of any illness that affects your day-to-day living activities? Perhaps you think of certain symptoms. For example, having no pain is good health. And if you are a clinician, you might be thinking even more specifically, like having no problems with insulin production. For example, like there's no problems with over insulin secretion, etc. Those might be another way of thinking health. So how can we measure health? Measuring health is about understanding how a condition or a healthcare intervention affects a person's health by finding out if they have any symptoms or if their day-to-day functioning has been affected. So how do we decide what to measure in health and how to measure health? So it is often dictated by what we intend to use the measure for. Say, for example, a doctor assessing whether a patient has high blood pressure would be interested in their blood pressure readings. And similarly, a clinical trial that seeks to assess how well a new drug for depression controls depression-related symptoms would rely on patient reporting their symptoms. So in order to measure health, we need to first understand what the patient feels actually, and what we need to measure based on what the patient feels. So there are different types of measures of health. So measures can be objective, which based on the clinical outcomes such as blood pressure, their bodily reaction, body temperature, etc., or could be subjective matters based on the patient's reporting how they are feeling, such as the level of pain, etc. Measures could be condition specific versus generic measures. So measures can be condition specific, that is related to only health outcomes specific to certain condition, or generic, like covering symptoms and other functional areas that are important for health in general. So measures can be assessed by a clinician, which is called proxy measures, or patient reported measures. For example, some mental health conditions such as schizophrenia, clinicians may complete health measures for the patient in order to diagnose or to clarify the severity of the patients. There are also cases when someone else who knows the patient, such as the carer for someone who has dementia, will complete the measure on their behalf. On the other hand, there are many health measures that are completed by the patients themselves. These are often referred to as patient-reported outcome measures, or PROMs. And then measures could be related to quality of life, that is health-related quality of life measures, or be broader than health, focusing on the well-being or overall quality of life. So these are the different types of measures of health, actually, which normally practiced across the world globally to understand outcomes of health. So patient outcomes. What are outcomes? Outcomes are the result of the treatment that patients care about the most. And outcomes are not just outputs. They are not lab results or not technical details. They are real world results like physical functioning or level of pain, etc. So the principle behind outcome-based healthcare is that healthcare systems should focus on delivering health outcomes rather than focusing on delivering interventions. Focusing on outcomes addresses the central problem that health systems today do not incentivize what actually matters. better health for patients is the actual outcome we need to look at actually. Unfortunately, today in healthcare system around the world, evaluation efforts take into account a number of clinical indicators, structural metrics, and even reputation, but they tend to ignore outcomes. So why patient outcomes is so important is actually patient reported outcomes are important because patients know best what they need actually. And outcomes can be achieved when it is co-designed. And if we work with the patients and patients telling us actually how they are feeling and what is happening with them with the use of medications, or if they are happy to continue the medication or not, or how are they feeling with the medication. So when they report about those things, then only we can actually co-design the outcomes with them. So to improve the outcomes in the healthcare system, the starting point is to focus on improving individual patient outcomes. So the principles of outcome measurement are, as stated by the International Consortium of Health Outcome Measurement. These are the principles designed by the Harvard University, actually from the big researchers and scientists. So outcomes should be measured by the medical condition or primary patient segment, not by procedure or intervention. And these outcomes should reflect the full cycle of care for the condition. That means if you put the patient at the center and design the measures across all the things, not just the clinical outcomes. Like, say, for example, if you give a medication, you should actually measure how that medication is influencing their general well-being and their mental health and then physical health, etc., all together, rather than just thinking, okay, this medication is causing some good results just for the condition. Outcomes are always multidimensional and should include the health results more relevant to the patients. So measurement must include initial condition or risk factors to allow risk adjustment. So there's always risk with any disease condition or any type of treatment. And even medication, when you actually prescribe a medication, there may be always adverse drug reactions. So you need to consider all those things before actually prescribing something or before administering something, and measure those initial risk factors and then adjust based on those risks actually to achieve the outcomes. So standardized outcome measures should be used in order to enable comparison and learning. So basically, when you are measuring outcomes, you need to actually use some set of standard measures which are already been used across the world, so that you can measure the outcomes and also compare and benchmark against them. So as I said, this is the typical example of an outcome measurement cycle. So say, for example, this is for advanced prostate cancer. So a person with advanced prostate cancer, what are we going to measure? It's not about measuring the cancer progression. It should also include the quality of life measures, or any symptoms related to the urinary or hormonal activity or hormonal symptoms, and patient-reported pain relating to their quality of life, and physical and mental well-being, and patient satisfaction, and patient awareness should also be measured. So you can see the cycle actually. So the patient should be at the center, and then you have to measure everything around them like a measurement cycle. So this measurement life cycle of a disease could be tailored to suit the requirement, or a set of standard measures could be used which are followed internationally and could be benchmarked. So the example about advanced prostate cancer is we use it in primary care in New Zealand actually. So the measurements could be done by a single clinic or practice setting where during a consultation, using a tablet or a computer or using a software, or sending out surveys to the patients after the consultation. So by measuring these outcomes, the complete cycle of a specific disease could be identified apart from the medical treatment and management. So from a clinician point of view, or a doctor who is actually seeing the patient, they would be more concerned about the medical treatment and management, but they should also consider the other underlying factors. Say, for example, a person is actually depressed and not taking the medication. So irrespective of what medical treatment you are giving them, they would still be not able to recover from it, and then not actually take the current condition wouldn't be improving based on whatever treatment you are giving. So this cycle could also inform the clinician even before the consult, and the clinician could track and trace the patient's condition if we measure all the quality of life measures and physical and mental well-being along with patient satisfaction and patient awareness. So patient awareness is quite important actually. I know in my practice in India as well, we used to give the medication without even making the patient aware why they are taking it and what is that actually, what is going to happen, or just treat them without giving the complete information about it. And in advanced disease conditions like cancers and stuff, I see a lot of doctors don't talk to the patient. Actually, instead they talk to the next nearby relatives or somebody else, which is not a good practice. The patient should know actually why they are actually taking these and what is going to happen to them, even though it's a severe disease. So this cycle, it gives a holistic view of patient care rather than just only medical treatment. So this is the typical dashboard actually we created using and standard tracking of patient outcomes. So we did like a pilot of 150 patients and tracked based on different questionnaires, and we can see different things on different times of the day, and patient outcome benchmarking against various countries, how the patient is benefiting from this treatment, etc. So this is just typical software. So there are several softwares in the market actually to measure outcomes, and also some new innovative softwares have been developed actually to see how the patient is tracking against each of the symptoms, or what we need to track and trace when you are actually dealing with a large group of patients, etc. So what are the benefits of outcome measurement? So when you measure outcomes, you understand the patient's needs better. So the patients could be telling you the things which you normally don't actually see in your regular practice, or when you see them in the clinic. And when you co-design with patients based on their needs, you get more information because they feel like they are part of the treatment, and they are actually also being involved in the treatment. So in order to measure outcomes, actually, we need to agree with some goals and expectations. So for any type of treatment, we should set some goals and expectations with the patients, and to understand what they want to achieve through this treatment. And timely and equitable access. So this applies to it's mostly all over the world. Is about actually how timely we are providing the service or the treatment, because in so many cases, actually, what happens is the patient delays to see a doctor until they go into a severe disease progression, especially in cancers. A lot of people don't ignore actually the early symptoms, and by the time they go to a doctor, they are into the advanced stage, and then they can't access the system or access the medical treatment at that time. So when you start measuring the outcomes right from the beginning and see how the patient is progressing against each of their quality of life indicators, then you can actually make them actually suggest them or make sure that they access the things proper times. A value-based care or tailored care can be built. This is very important in abroad, actually, where because it's all funded here, we actually measure each and every dollar we fund. And at the ministry, my role is actually to design these value-based care models and outcome measurement frameworks to understand the funding we are spending is actually making any difference. But in private care or in insurance model in US or somewhere else as well, this is very important because they don't want people to be sick and end up in hospitals, because that adds a huge burden on the clinicians and also the hospital system. And also they need to spend more and more money in order to treat patients. So that's how value-based care or tailored care is so important in identifying what are the needs and what are the requirements for the people and what we need to measure while um, preventing extra costs and stuff like that. And again, early detection of symptoms and preventing hospital admissions would be the goal and benefit of outcome measurement. So we can track and trace a person right from the beginning. Say, if we say like you have seen a patient who has a risk of cardiac problems in the future, who has a family history of severe cardiac diseases, who has a family history of blood pressure. So they would generally they would tend to end up into acquiring the disease and getting a heart attack and stuff like that. So you can detect those symptoms and signs actually early by doing an outcome measurement and following them up regularly to see whether they are actually following the advice or not, and then thus preventing the hospital admissions, etc. Preventing any adverse outcomes of health. The most utmost adverse outcome is death. So how do we prevent people dying? So the latest technology and all, they are aiding actually to treat the disease, and like the robotic surgeries and surgeons actually designing some new techniques of surgeries to save people. But preventive medicine is more about actually prevention of those things happening at the front. So how do we actually prevent those diseases is actually by measuring and monitoring people. So I know in Indian practice, it's huge actually, and we see nearly 100 patients a day, and you can't actually track and trace each and everybody. But with the more latest innovation and technology, there are a lot of things, and everybody is using a smartphone or smart device or even Apple Watch or something, which could also track their progress and track their things. And using all those technology and innovation, actually, we can track and trace people's general conditions, etc., and also design outcomes for people. So we're piloting a mini project like that actually in New Zealand to understand how we can measure outcomes by patients reporting actively about their conditions and symptoms and things. So in New Zealand, from time to time, we work on some innovative projects actually to understand and analyze the results from various outcome measurements. So we use simple survey methodology. So outcome measurements can be also measured by using a simple survey regularly with the patients, asking them few questions, and also some globally accepted outcome measurement tools. Like, have you heard about the quality of life tools like EQ5D, EQ5L, and also other types of tools like PHQ, etc. Those are used to actually measure outcomes and mental health well-being, etc. So, so how pharmacists can use patient-reported outcomes to better manage patients? So globally, actually, pharmacy industry has been doing this outcome measurement from a long time, but It's more specific to pharmaceutical drug reactions or drug adverse events and stuff. But in the latest method, pharmacists could also actually be part of the um, overall outcomes of people. So, from by measuring patient-reported outcomes, what are the benefits to the patient is at the patient level. Patient-reported outcomes can be used in a number of ways to improve care, and pharmacists may intervene to assess medication adverse effects or success of symptom control or efficacy, etc. So I'll give you an example actually. 1 in 4 patients receiving interferon therapy for hepatitis C virus infection will develop some form of depression. And this is particularly important to monitor as dose adjustments may be needed depending on severity. So without appropriate monitoring, the patients may be forced to prematurely discontinue therapy or may become worse or may attempt suicide in some cases. So using a PHQ-2 or PHQ-9, these are the mental health forms actually to understand whether they have depression or not. These are the outcome tools actually for mental health. The pharmacist would be able to assess for depression and intervene early. So using in India, the clinicians mostly prescribe the drugs and medications, but they wouldn't actually consider the drug interaction and the side effects of it to actually manage them in a proper way. They would just see what is the latest drug, what is the clinical outcome of it, and then they will just prescribe it. But they wouldn't actually consider the other measures. You need to measure. Did you ask? You need to ask about any depression and other stuff? So benefits of outcome measurement to the pharmacists or people with pharmacy background is actually by collecting and analyzing this patient-reported outcome data. Specialty pharmacists like you guys, like Pharma D students or pharma doctors, actually can assess care on an individual level as well as a retrospective review of entire cohort of patients. So specialty pharmacists are able to assess health-related quality of life outcome through the application of validated patient-reported instruments, which is what I told you before, EQ5D or another SF36 or different quality of life tools, and use this data in the analysis of discontinuation rates, report adverse events, and the cost impact on the system. I'm not sure whether in India they consider about the cost impact, but in abroad, actually, the cost impact of people not actually adhering to medication is quite high. And if they don't actually take the medication regularly, you wouldn't even see the effects of the drug. So the researchers, what they report is based on actually the adherence and efficiency of the drug trials is based on the patient taking the medication every day. So these reports can help identify trends in population health and assist in the development of disease-specific clinical management programs. Additionally, this data can produce valuable information which is lacking from most initial drug approvals as well. And recent technological advancements have helped increase opportunity to engage patients in their own care and to collect subjective treatment-related outcomes. People are now able to share information effortlessly globally because everybody uses a smartphone. Everybody is using some sort of platform, and they are more into reporting their outcomes. And pharmacists can and should take advantage of such opportunities, actually. So there are quite a lot of online registries which are emerging in specialty disease population. So enabling patients to participate in scheduled online surveys regarding their treatment and or their disease, and text messaging programs in which patients have the ability to report their symptoms, moods, and treatment experiences, and also increasing in prevalence, etc. Through such novel methods of patient engagement, pharmacists, scientists, and payers are able to collect large amounts of patient-reported data in ways to not previously available. And this data could be analyzed and utilized actually to understand the whole picture of the patient outcomes, and also for a bigger population as well. So in my experience, actually, when we measure outcomes, we not only measure for each individual, we also measure for a bigger cohort or a group of population against another population. So usually research and studies actually involve actually having a cohort group and a control group. So we give a drug or a medication to one particular group and test the efficacy by measuring all the outcomes and using the tools which are measurement of quality of life and patient adherence to the medication, etc. And then compare with the control group where they would be not given all these things, and we haven't asked them anything, and are they actually adhering to the medication or not. So in most of the cases, so my other project, which I'm quite interested working along with the government of New Zealand here, is about medication adherence. So we have identified that most of the diseases progress because of people not adhering to medication. So the doctor prescribes, but the patient doesn't take the medication. A lot of times they will discontinue the medication. So say, for example, if somebody has a simple infection or throat infection, usually the clinician would prescribe them to take antibiotic for 7 days. But a lot of people would feel better in 3 days, and then they will discontinue the medication, which causes actually the bacteria to gain what do you say, like it gets accustomed to that antibiotic, and then it doesn't affect them in the future. So adherence is quite important, and that's how people need to adhere to the medication. So I hope you all had a good understanding about health outcome measurement. Thank you for giving me this opportunity. Any questions are welcome. Actually, you can ask me if you want to understand better.
So hi, Dr. Sreekanth. I'm Karthik.
Hi, Karthik. Yes.
So yeah, thank you so much for taking your time on a Sunday, and there are other important occasions happening in your family. So I
That's
just
okay.
came to know that yesterday.
That's okay.
I
Yeah.
just wanted to share a couple of things. For last 2 months,
Mm-hmm.
I'm in touch with Dr. Sreekanth and one of his colleagues, Dr. Mohan, on a project we are working. And during the course of those interactions, I learned a lot of things about healthcare in New Zealand. And the way Sreekanth conveys his points, it is easy to grasp. Like I can hear to him for hours together without getting bored. So I was really fascinated about learning how healthcare works in New Zealand. And I hope
Mm-hmm.
someday, maybe after a few years, few aspects might translate into Indian practice also. And
Yep.
second thing, Dr. Sreekanth, we have these participants from Pharm, which is a
Mm-hmm.
program started very recently. 2008 it was started. So
Mm-hmm.
basically to train pharmacy graduates in clinical pharmacy practice and not the traditional pharmacy, which includes production of medicine, their quality, etc. So we are
Yep.
actually included in the clinical practice. We go on rounds with doctors, analyze
Yep.
their prescriptions and find out if they're an issue. So as
Mm-hmm.
a part of our 5th year, we do some projects, which
Yep.
is mandatory to award our degree. So will you be interested to give any suggestion to students if they wish to work on projects related to outcome measurement? Because here it is very rare. At least in my understanding, I have not seen any pharmacists
Mm-hmm.
doing projects related to outcome measurements. And maybe even in medicine, it might be true.
Yep.
So will you be interested in working with such projects? I know time is a limitation, but 90% of effort will be from our side and maybe just
Sure.
10% here and there. So can you talk about that later?
Yeah, sure. Yeah, I'm happy to mentor people in projects actually, and what to do to measure outcomes. It could be a simple measurement as well, like you can take a set of people who you are actually taking care of and measure some things using a questionnaire. So yeah, I'm happy and interested to actually give advice to anybody who's interested to do. And outcome measurement also involves health economics, which is the current trend in the world across the globe, actually. So, if you are also interested in doing outcome measurement training or studies, actually, there are several courses online, but they are really costly. And but some offer free courses as well to understand about outcome measurement. So you can always sign up for those, and I'm happy to guide you in terms if you're interested actually.
Yeah, and on screen we have donated few trees on your name. So this is just a small token of appreciation and gratitude from all of us. So,
Thank you. Thank you.
and now it is open for students. If you have any questions, you can ask. You can share your feedback also. We have 15 more minutes. 15. Yeah.
I know this perfect silence. This is not a classroom actually. If you have any questions, feel free to ask.
Hello, sir. Myself, Satyashree. First of all, thanks a lot for taking your time out for having a session with us, sir. It was really great. Uh, all the points which you have mentioned in improving the outcomes were really important, especially the involvement of patients, which is not generally given much importance here. And most of the patients are not properly aware of the medications also. And it was very unfortunate that some of the patients are not aware of their disease condition itself. So
Mhm.
all those points really make a significant role in improving the patient outcome. So thank you so much for such a wonderful session. Thank you, sir.
Thanks, Satya. Yeah, it is important actually. So I practiced in India as well. So in my practice, I observed that we not actually discussing anything with the patient and not giving them the full information how this thing is going to affect or how the medication is going to affect and how the disease is progressing. So patient education is quite important in terms of achieving better outcomes for people. So a lot of times, actually, the doctors forget to do that because they are so busy, and the specialists in India, what happens is everybody goes to a specialist because they think that he's the ultimate doctor, and they forget about all the other doctors and even you guys actually as pharma D specialists, and they wouldn't actually consider people other than as consultants or specialists as experts in their care. So it's about actually educating them and giving them that sort of experience or concern to them actually would help in achieving better outcomes.
So, Dr. Sreekanth,
Thank
I
you, sir.
have a question. Like, can you tell about some really interesting ways in which healthcare is looked at in New Zealand compared to other countries in the world?
Yeah, sure. So why I was interested in New Zealand's health system is because, and then why I moved to New Zealand is I did quite a lot of research before moving to New Zealand. So New Zealand health system is completely public health. It's publicly funded healthcare system. So the Ministry of Health funds for each and every person in New Zealand. So even if you are a citizen or a resident or a visitor, you will be covered by the ministry or the public health system here. And even for any injuries, ACC is another organization where I worked as well as a medical advisor. ACC means Accident Compensation Corporation. So basically, it's a social insurance scheme which helps anybody who enters New Zealand. So because you're taking a visa to come to New Zealand, you will be paying part of that visa for your healthcare as well. So when you enter New Zealand, you are responsibility of New Zealand government actually. For any accident, say people who come here for doing hiking and going on top of big mountains and stuff, they get injuries and then they get admitted to hospital and needed further surgeries and stuff. So that's all funded by the government because you have already paid levy on that actually while you are coming to New Zealand. But simple cold and cough and simple diseases, they are not covered for visitors. But for all residents in New Zealand and all citizens in New Zealand, entire healthcare is covered by the government. That is actually taken off from our taxes. So we pay 33% tax here. So that's how the whole public health system here in New Zealand. And as part of that, New Zealand always tries to innovate ourselves and provide better health services, which is globally accepted, and then identify the right things at the right time. So say, for example, the COVID-related control, why New Zealand has exceeded and achieved controlling COVID is because of our public health system and our the things we did at the right time. So that's how we could control COVID. So our director general, my boss actually, he's a public health physician, and he's experienced working for the WHO and across the world actually in designing preventive medicine stuff. So we applied all those principles during COVID time, and we took the actions appropriately. And the lockdown did work for us. It didn't work for India and any other country in the world, but did work for us because people were compliant here. People respected the advice, listened to the doctors and people who advise for their health, and then they followed those things. So when people take their health into their own hands, that could be achievable. So that happens only when we actually involve the people into the practice, involve and explain it to them what is good for them and what is not good for them. I know it is really difficult to change the behavior sometimes, but for people who want to change and to listen, that could be achievable. So that's the interesting thing, how we actually managed the COVID here in New Zealand. Other thing is, because we are an island nation, we could easily lock the borders and prevent entering into the country. So that's how we could actually control at the border itself. There are a lot of innovative projects happening in New Zealand, and New Zealand's health system always looks for different innovations and technology to be used in the system so that we can actually improve ourselves. And it's in New Zealand, we follow a continuous improvement methodology. So we want to improve ourselves every time rather than just following the same old things actually. So if we don't have an improvement, we cannot achieve what we are aiming for, or we cannot, because the things change every time. Like yesterday, there would be some other disease which is more important. But today, this is COVID is the most important one. So if we don't improve our practice and adopt quickly, we can't actually survive in this world. So that's why in New Zealand we tend to improve ourselves every time and look for things, and for I think for at your level, at the student level, it's good to actually participate in a lot of meetings and discussions and listen to the global leaders, what they're talking about, and pick a point of interest. Like, say, if you guys are interested in outcome measurement, or if you guys are interested in the medication part, why medication is so important and why medication adherence is important, and then you always think in a research focused way. Go for it and look for options. What is the Google is a great source of knowledge. Actually, if you search on Google about different things, that will give you more links, and then you can attend into that one and then see how it leads to your career and progression. So I think the best way is to start researching about your interests and what you want to go for.
Thank you, Dr. Yeah, actually, you answered part of my question, which I was about to ask. So
Okay.
now you are like advisor to Ministry of Health, Government of New Zealand, which I don't think is an easy position to reach. So
Yes.
what tips do you give for our students? So what qualities do you think took you there, and what are any suggestions for students who are ambitious and want to get into higher positions in healthcare?
Yeah, sure. So it's not easy path, but I could achieve it. So anybody can achieve it, actually. So my intention was actually to come to New Zealand and practice in New Zealand as a consultant or something. But I chose public health because I was interested in community, and then a broader scale in planning and data analysis and stuff. That's how I ended up as a principal advisor at Ministry of Health. So principal advisors in ministry means they are the topmost intellectuals in health sector in New Zealand. And I'm really fortunate to be selected for that role because out of all the people here in New Zealand, and I could say I'm the only Indian as a principal advisor in New Zealand. So that is a great achievement for any Indian abroad, actually, because it is not easy for Indians to get into higher positions abroad, because there are so many people and there is so much knowledge around you. For that path, what I did is actually I always looked at improving myself every time and research oriented. I always used to do research. What is the current situation and what are the gaps in our current thing? So some people would be happy with the continuing the regular thing what they are doing at the moment, but I was more interested in actually, okay, what is the gap in this practice and how we can actually improve it? What are the things? So I used to research thoroughly on everything to see, okay, what can we do better? How can we actually make it better? And how can we move on to the next level and then find solutions for this type of thing? So that's how I progressed, actually. So I started as when I was studying public health, I did a presentation like this actually to a group of people in my university. And during that time, one of she was the CEO of one healthcare organization. She saw my presentation and she invited me to be part of a group to do a research in her practice. So I raised my hand and then quickly joined their team and provided a lot of things to them. And then she offered me a role while I was studying. Actually, she offered me a role as a health advisor in their practice. So it's about actually taking the opportunity. Sometimes you need to be at the right time and right place actually to get the opportunity. But when you have an opportunity, you need to grab it and then improvise yourself and then prove yourself towards actually achieving your goal. and you need to set a goal or a target where you want to be in the next 5 years or next 10 years and work towards that path. And you need to take a mentor. So you don't need to actually reinvent the wheel. There would be some mentors like Karthik or somebody else in your field actually who would guide you how to achieve things in a easy or a fixed path where they could guide you guys. So you need to follow them and follow the people, the right people, to actually guide you to where you want to go. And when I was a student, actually, what I used to do is I used to look at different people's qualifications and how they achieved those qualifications and what is the path they took actually to be there. So I follow quite a lot of specialists in terms of my interests, and also when I meet them at a conference, I follow them on LinkedIn and things. So I see a lot of you are also doing that. So that is really good, and I appreciate all of you actually doing that. It's really good to understand how your mentors or people actually have progressed and what did they do in their path. And it's not that difficult when you know the right things and practice in the right way. So yeah, I would encourage anybody actually to follow the path. And it can be anybody actually. So in New Zealand, you don't need to be a doctor actually to be a principal advisor. You can actually be anything, but your progression and your work things have to be aligning with what the ministry's vision is. So here, every organization will have a vision and a aim actually where we want to go and what we want to achieve for the people. So if your vision and aim matches that, then you can be that person. Thank you.
Thank you so much, Dr. Sreekanth. And any student, if you want to share a feedback, one quick feedback before we end in next 5 minutes, you can do. Anyone from Guntur?
Hello, sir. This is Samiksha. Thank you so much, sir, for just explaining us the measuring of health outcomes, as it's a way different topic when we consider clinical scenario. And these are the like bullet points we need to focus on when we come to health. So thank you so much, sir. I had this one question, sir. When we talk about health, it's all related to clinical scenario, but like clinical implications or something like that. But we also have a lifestyle management as a point of view. So what are your views? I would like to know just that when we come into lifestyle management, how is it in reinforcing in this world right now? Like.
Yeah. So when people say health means, they just see the clinical part actually, like there is no disease, there is no part. But as I talked in my first slide, actually, health is not just about the clinical outcome. It's about their physical well-being, their social well-being, their mental health. So it includes all the things in lifestyle management. So say, for example, nearly 80% of diseases, chronic disease conditions in India, are because of the problems in their lifestyle, actually.
Yes.
So yeah, and especially diabetes, which has the highest rates of diabetes in India, actually, compared to anywhere in the world, and it's still fastly growing in India. And that could be prevented if there are some simple lifestyle modifications right at the beginning itself, and like a regular exercise and regular food habits, like eating at the same time. So here in New Zealand, nearly 80% of us actually eat lunch at 12 o'clock sharp and dinner by 6:30, 7 o'clock. And we sleep by 9 o'clock in the night here. And we don't overwork or overdo our things, and we only work 8 hours per day. So that following that simple regime actually could prevent you from getting any serious diseases and improving your longevity as well. So the average life span in New Zealand is 90 years, and then it increases more. There are a lot of people who are live more than 100 years here because of that simple regime. So lifestyle modification is very important in terms of achieving people outcomes, health outcomes as well. So yeah, so when you are actually explaining it to the patient, you have to explain around what are the benefits out of it actually. So a lot of clinical advice in India is more actually around making people worry about their things, because the more they worry, the more they come back to a doctor, and the more they pay for it actually. So that's how it traditionally the system is. But actually it should be opposite actually. You need to support the patient, and you need to give them more advice to actually manage by themselves. Then only you can achieve the outcomes for the people. Thank you.
Thank you, sir.
Yeah, Alvin, actually, you can stop YouTube stream. You can stop it streaming on YouTube. So, Dr. Sreekanth, do you have any plans of moving back to India, maybe after a few years, and practice here?
I thought about it actually. Both my parents were doctors in India, and we had our own hospital. But I wanted to pursue something different and progress into the global environment and global health. But yeah, at the moment, I don't have any plans to come back to India. But we are mostly settled in New Zealand, so we are citizens here. And yeah,